Dr. Diaz, if I ask you about bone grafting, what can you tell us about when is it needed, when is it not needed? Is it these days a complicated procedure? Why does it come about in the first place? Tell us all about it, if you can, in layman's terms, of course, so that we can understand it here.
Okay. Sometimes, as a dentist, I'm in the business of saving teeth, but sometimes a tooth just cannot be saved. So in those instances where a tooth has to be removed, it is very important for future considerations, and I'll explain that in a moment, that when that tooth is removed, there's an extremely large hole left in the bone where the tooth used to be. As that area heals and the bone fills in, that area shrinks. It gets very, very small compared to the amount of bone and the width that bone was when the tooth was there. So, when a tooth is removed, most people are going to want to replace it. And there are different ways to replace it. If we talk about replacing it with an implant, okay, that's where an artificial root is put back into the bone, back where the tooth used to be.
By artificial root, you mean a metal stick?
A metal post, a metal stick, yeah, we call it an implant. But yes, it is a titanium post that goes right into the bone. And it's got a special coating on it so the bone grows to it. Well, just like a tooth needs a lot of bone around it to support it, okay, so does this implant. If a tooth is removed and the bone just is left to heal on its own, and it heals like it normally does, where it shrinks, you don't have as much bone then to support an implant. With bone grafting, it's very simple these days. You can remove a tooth, and at that same appointment, right after the tooth is removed, there are bone grafting materials, and there's all different kinds, that can be placed into the socket or the hole where the tooth came out, and it will help regenerate a healthy amount of bone. So it preserves the original shape and the original amount of bone that was there when the tooth was there.
You said that. You said there are all kinds of materials. I thought that you might be taking the bone from somewhere else and put it on, basically from the body. Is that old technique, or was that never? Am I just mistaken here?
No, and a lot of times, I'd say it was more common 10 years ago, 15 years ago. I lose track of time. But yeah, a lot of times when a surgeon was putting an implant, an artificial root, a metal rod, into the bone, they would take extra bone from the patient's hip. Well, what the patient complained about most was it wasn't the site where they put the artificial root. It was where they took the bone from in the hip. That is pretty rare these days. Matter of fact, I can't remember the last time we've had one of our surgeons do that. Basically, we're getting freeze-dried bone that can be harvested. You place it into that socket and it's harvested, and bone grows. So there's no discomfort. It's just the patient really and truly doesn't even know that we did anything other than when it heals, you got a nice healthy amount of bone where that tooth used to be, which makes it very, very easy to then place a predictable implant or artificial root.
So, but it's possible that there was no bone loss and you don't need a bone grafting doing an implant, correct?
It is possible, but I will tell you, you're going to lose some bone no matter what. Okay? And if you heal and the bone shrinks and then there's not enough for the implant, it's much more difficult than to graft bone. Okay? Then a lot of times a surgeon has to take it, excuse me, from an area like the hip. But it's so simple and so quick and relatively inexpensive to put the bone grafting material into the socket where the tooth used to be, excuse me, at the time of the removal of the tooth, that it's just not worth taking the chance.
Oh, I see. Okay. Well, that's if you don't put an implant in it right away, right? Or even if you do put an implant in.
Most of the time, the surgeons that we're working with, they want to let the area heal where the tooth was removed for about 3 months to see how well the bone regenerated, how well the bone healed.
I got it. So does such a bone grafting also serve the purpose of like a person who had a bunch of teeth for a while, and then he looks like a dried out tomato, and which is really the main reason why people have this caved-in old look. Is bone grafting one of the methods used today to bring that younger look back?
Yeah, if you lose your teeth prematurely, or you lose a bunch of teeth, like you say, okay, then let's just take the front area, okay, that you get that caved-in appearance. If you can maintain the original bone that was there, then when artificial teeth are placed, either with a bridge, and basically a bridge is where natural teeth are holding artificial teeth in place, okay, or with a denture. A denture is something you take in and out. If you can restore or maintain the original amount of bone, then you won't have that dried tomato, dried prune look. Okay, you'll still have the natural full contour that the patient had before the teeth were lost.
Beautiful. Is it possible that a bone can shrink or disappear so much that it's too late? You can't never put an implant in anymore. You can't graft it up anymore. Is that a possibility?
I will tell you that it becomes much more difficult.
Which is good. Which is a good thing, right?
Yeah, I hate to say never.
Yeah.
But yeah, I mean, we've seen some where the surgeon's like, oh, we're not sure how this is going to turn out. So it's just not worth taking the chance. It really isn't. So as long as you have bone there, you can usually put some satisfactory prosthesis in for the patient, as long as there's good, healthy bone there.
So basically, even if there's very little left, you usually can do bone grafting, and it kind of like comes back, and then you can put those implants or those implant dentures in it or whatever.
That's right.
Good. Right. So that's good news, right?
Yeah, sure, that's good news.
That's good news. So that you can fix everything. But just because your dentist can fix it all, it doesn't mean we should let it get to that level, right?
That's right. Because if you let it get to that level, it is so much more difficult, and I might add, much more expensive. To correct.
And unlike that, most of us people think that you guys are, kind of rubbing your fists because there's a $30,000 case coming in. You, on an average, with most doctors I work with, one way or the other way, which I have, seen and my own doctors and stuff, they much rather see 100 people for relatively little work and for preventive work than 5 half dead. Right. Just the nature of your doctors.
I couldn't agree with you more. Yeah, I couldn't agree with you more.
And we patients sometimes become cynical and keep forgetting that. Do you understand? We keep thinking that, well, of course you do need to get paid. We all need to get paid for what we do, otherwise how the heck do we eat? But the point is, it's much rather to keep the population healthy than fixing them after they're sick, because usually that goes hand in hand with they don't have the money anyway. So So anyway, thanks a lot, Dr. A.Diez. You're very informative.